Village Reach's goal is to improve both the quality of healthcare as well as the reach of healthcare for remote, underserved communities. So, for example, the one country that we work in, Mozambique, is the size of California, Oregon, and Washington. And so you're looking at serving health centers that are spread across vast areas. The challenge is that as you go further out to the more remote areas, the infrastructure gets more challenging, the roads are more difficult. To distribute vaccines have to be kept cold. You need a refrigeration system called the cold chain. The cold chain needs energy. In our case, there was no energy. And rather than taking the money and building that distribution channel just for the government, we actually put it in a private company in order to provide propane, and by doing that, lower the cost of the infrastructure and create a profitable, growing business. It's a little different in that, okay, if the channel didn't perform well and the Microsoft products didn't get to Shell Oil, well, they didn't have Microsoft products. Now what we're talking about is if the malaria vaccine, the various drugs don't get through the health system to these remote areas, children die. Bringing the propane in allows us to provide that energy to this year's children, next year's children, and next year's children in a sustainable way. It's a model for a lot of other innovations that can be done in this area to improve distribution, to make sure that the medicine reaches those who need it most. I mean, that's the exciting part for me. I mean, it takes me back to Microsoft, where we had problems and we sat down and figured out how to solve them. But in this case, the stakes are much higher.